I'm Dr. Wix-Harris, and I'm a cosmetic physician in Martinsville, New Jersey, and I work at Reflection Center. I specialize in minimal invasive cosmetic procedures, and one of my favorite procedures to do is a combination of Ulthera and Sofwave for lifting and tightening of the lower face and submental area. Combining these two treatments can sound a little bit counterintuitive. These two brands often market themselves as alternative to each other, so it might be a bit confusing for people to understand why we are actually combining them. These devices both use the same technology, which is microfocused ultrasound, to treat the tissue and rejuvenate, tighten, and lift. So even though Sofwave and Ulthera both use microfocused ultrasound to create the effect of rejuvenation, tightening, and lifting, the big difference is the depth of treatment. Sofwave only has one handpiece and it works at 2 millimeters deep, which is the deeper part of the skin. And it does that very effectively. It has built-in cooling, which can also help to make it a little bit more comfortable. The handpiece is bigger and is a little bit faster than the Ulthera. Ulthera, at the other hand, has 3 different handpieces, one at 1.5 millimeters, one at 3 millimeters, and one at 4.5 millimeters. And this allows you to select the depth that you want to treat somebody at. And if you're trying to tighten the muscle, in most people that's either at 3 or 4.5 millimeters. So the best way to get tightening of the lower face and the submental area is to treat both the muscle and the skin. And therefore I will use Ulthera to treat the muscle part, and then I'll use the Sofwave to treat the skin part. Before Sofwave came on the market, we used to use Ulthera at 2 different levels. One was the skin level and one was the muscle level. However, the negative is with Ulthera that sometimes at the skin level, which was at 1.5 millimeters, people would end up with welts on their face, and it was also a little bit more uncomfortable. So when Sofwave came on the market, it works really well for the skin, but it just doesn't treat deep enough to also affect the muscle. The kind of patient that this will work best for are people who have mild to moderate laxity of the lower face. It also works really well for people who are trying to prevent aging by just keeping up the collagen level and the elasticity of the skin and muscle. There will be a link in the description and in the iLink that covers Ulthera and Sofwave more in depth. A lot of times I will also recommend to combine fillers with the combination of Sofwave and Ulthera for the best results. And that's because at the same time as you're starting to lose collagen in the skin and the subcutaneous tissue, you're also starting to lose volume in the face, and that contributes to the older and saggy appearance of the face. If you start this early and conservatively, you can actually control your aging in the face. You know, if you wait till you have lost a lot of volume and you're very deflated and very saggy, you create wrinkles in the skin that are much harder to improve by trying to restore volume. If you stop your face from deflating and prevents your cheeks from kind of really flattening and falling down, which creates wrinkles and smile lines, you can really maintain a very youthful appearance into your 50s. This is really not achievable for somebody who allows their face to deflate and the cheeks kind of to create those deep wrinkles. Even if you kind of use fillers to restore some of that volume loss, you're still going to have those deep lines in the skin, and it's going to be much harder to improve. It's a very effective way to slow the aging process and create very natural results. If you're interested in discussing any of these options and to see if these are good effective treatments for you, or if you need something else, I welcome you to make an appointment with any of our physicians for a free consultation.